Hi, my name is Kevin Encarnacion, and I will be reading Professional English in Use of Medicine, chapters 14 to 23. Chapter 14, Symptoms and Signs. Opposite A, Describing Problems. The problems which a patient reports to the doctor are called symptoms, for example, pain or nausea. Signs are what the doctor finds, also known as findings, on examining the patient, for example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaints. To report a patient's symptoms or complaints, doctors say, Mr. Farnsworth was admitted complaining of chest pain. In case notes, the abbreviation CO is used. B. Presentation. Patients say they went to see the doctor. Doctors say the patient presented. The symptom which causes a patient to visit doctor or to present is called the presenting symptom, presenting complaint or presentation. For example, his presenting symptom or presenting complaint was chest pain. He presented to his GP with chest pain. The usual presentation is chest pain. C. Talking about symptoms. The symptom is tiredness, lethargy, fatigue, lassitude, meaning loss of energy. Patients say, I feel tired all the time. I feel completely worn out. Lately, I've been feeling completely exhausted at the end of the day. Symptom malaise, meaning general feeling of being unwell. Patients say, I feel unwell. I don't feel well. I've been feeling off color for 2 days. I haven't been feeling myself for a week. I've been out of sorts all day. Symptom anorexia, meaning loss of appetite. Patients say, my appetite is very poor. I've been off my food for days. Symptom weight gain, increase of weight in weight. Patients say, I've put on 8 kilos in the last year. I've gained 5 kilos. Symptom weight loss, meaning decrease in weight. Patients say, I'm not eating any less than usual, but I've lost a lot of weight recently. Symptom constipation, meaning hard, infrequent feces. Patients say, my motions are very hard. I've been quite constipated lately. I'm not very regular. Note, the verb feel is also used with other adjectives such as hot, cold, nervous, anxious, dizzy, weak. For example, she said she felt dizzy. Chapter 15, Blood. Opposite A. Full blood count. In the investigation of blood diseases, the simplest test is a full blood count, FBC. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, the volume of the cells, the erythrocytes and the sedimentation rate, ESR, a measurement of how quickly red blood cells fall to the bottom of a sample of blood. B. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding or loss of blood, excessive destruction of red cells, and low production, for example, because the diet is lacking or deficient in iron. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor. Professor, what's the most likely diagnosis in this case? Student, most probably carcinoma of the bowel with chronic blood loss. Professor, what's against that as a diagnosis? Student, well, he hasn't had any change in his bowel habit or lost weight. Professor, what else would you include in the differential diagnosis of severe anemia in a man of this age? Student, he might have leukemia of some sort or aplastic anemia, but that's rare. It will be very unusual. Another cause is iron deficiency, but he seems to have an adequate diet. Professor, okay, now there's another cause of anemia which I think is more likely. Student, chronic bleeding ulcer? Professor, yes, that's right. But what about pernicious anemia? Can you exclude that? Student, well, he's got none of the typical neurological symptoms like paresthesia. Pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in his textbook. Pernicious anemia is a condition in which there is an atrophy of the gastric mucosa with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue, glossitis, is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. Onset means beginning. Insidious means slowly developing. Pallor, lack of color. Mild, slight. Jaundice, bilirubinemia. Breakdown, division into smaller parts. Bone marrow, soft tissue in the cavity of bones. Symmetrical, each side the same. Vibration sense, ability to feel vibrations. Progressive, continuing to develop, and palpable, can be felt with the hand. Chapter 16, Bones. Opposite A, bones. Some common English names for bones. English name, skull. Anatomical name, cranium. English name, jawbone. Anatomical name, mandible. Spine, vertebral column. Breastbone, sternum. Rib, costa. Collarbone, clavicle. Shoulder blade, scapula. Thigh bone, femur. Kneecap, patella. Shin bone, tibia. B. Fractures. A fracture is a break in a bone. Some of the different types of fracture are crystic, displaced, comminuted, impact, open, or compound. A pathological fracture is fracture in a diseased bone. A fatigue or stress fracture is due to repeated minor trauma, for example, long distance marching or running. C. Treatment of fractures. When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture, replacing the fragments in their anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example, a splint or plaster of Paris cast, or internal, for example, a pin or a plate and screws. A displaced fracture which is not reduced may result in malunion, incomplete or incorrect union. Note, the verb reduce has several meanings in medicine. It can mean to make smaller, in surgery, to return to anatomical position, in chemistry, to remove oxygen or add hydrogen. Chapter 17, Childhood. Opposite A, milestones. Childhood is the period during which a person is a child. It ends with puberty, the onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestones in a child's development and the ages at which they usually occur are sitting by 9 months, crawling by 12 months, first words by 18 months, walking by 18 months, and talking two word sentences by 3 years. B. Common infectious diseases. Disease, morbilli or rubiola, common name is measles, rubella, German measles, varicella, chickenpox, infectious parotitis, mumps, pertussis, whooping cough, acute laryngotracheitis, croup, scarlatina, scarlet fever, rheumatic fever, tetanus, lockjaw, poliomyelitis, polio. C. Celiac disease. A medical student has made some notes while reading her textbook. Celiac disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but in infancy it appears after weaning onto cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition and there may be some abdominal distension. There is delayed growth and delayed puberty, leading to short stature in adulthood. Sensitivity means having a negative reaction to weaning, changing the diet from milk only to solid foods. Clinical features, the symptoms and signs of a disease: malabsorption, poor absorption, malnutrition, poor diet, adjective, malnourished, thrive, grow strongly, distension, swelling, delayed, later than expected, failure, when something that is expected does not happen, stature, size, especially height. Chapter 18: The Endocrine System. A. Excess and deficiency. An excess, too much, or a deficiency, too little, of circulating hormones causes a wide range of medical conditions, for example, hyperthyroidism and hypothyroidism. Where there is an excess of hormone, one form of treatment consists of giving the patient something which inhibits the production of that hormone, as in the use of carb- carbimazole to treat hyperthyroidism. When a hormone is deficient, treatment may be by replacement therapy, for example, injections of insulin in the treatment of type 1 diabetes. Doctors say sufferers of type 1 diabetes are deficient in insulin. B. Negative feedback systems. Number 1. TRH, thyrotrophine releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid stimulating hormone, in the pituitary. Number 2, TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4 thyroxine and the T3 triiodothyronine, and also to release stored hormone producing increased plasma levels of T4 and T3. Number 3, T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion. C. Goiter. An enlarged thyroid gland is called a goiter. The enlargement may be diffuse, involving most of the gland, or localized, limited to a particular area, as in a solitary nodule. The increased blood flow in diffuse enlargement, for example in Graves' disease, may give rise to a palpable thrill, vibration felt with the hand, and an audible bruit, noise heard through a stethoscope over the gland. D. A letter of referral. Mrs. Davis's doctor has referred her to an endocrinologist. Dear doctor, I would be grateful if you would see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She describes herself as an overactive, and at first she thought the weight loss was due to this, but more recently she has developed palpitations, diarrhea, and heat intolerance. She has noticed that her hands have a tendency to shake. Her symptoms suggested hyperthyroidism, and this was confirmed by my examination, which revealed an enlarged thyroid, red sweaty palms, and a fine tremor of the hands. Overactive, which means more active than usual. Palpitations, awareness of rapid or irregular heartbeat. Fine tremor, very slight involuntary movements. Heat intolerance, an ability to cope with high temperatures. Chapter 19, the eye. A. Parts of the eye: eyebrow, eyelashes, pupil, eyelid, iris. B. Examination of the eye. Here is an extract from a textbook description of how to examine the eye. Look for squint, strabismus, drooping of the upper lid, or oscillation of the eyes. In lid lock, the upper eyelid moves irregularly instead of smoothly when the patient is asked to look down. Next, examine the pupils and note whether they are equal in size, they are regular in outline, which means they are evenly circular, they are abnormally dilated, which means large or constricted, small, they react normally to light and accommodation. To test the reaction to accommodation, ask the patient to look into the distance. Hold your finger in front of their nose and ask the patient to look at it. The eyes should come together or converge, and the pupils should constrict as the patient looks at the finger. Check also for cataract, which is opacity of the lens. C. Retinopathy. Hypertensive changes in the retina can be classified from grades 1 to 4. Grade 1. Silver wiring, increase in the light reflex of the arteries only. Grade 2. Grade 1 plus arteriovenous nipping, in, indentation of veins where they are crossed by arteries. Grade 3. Grade 2 plus flame shaped hemorrhages and cotton wool exudates. Grade 4. Grade 3 plus papilledema. Chapter 20, the gastrointestinal system. A. Examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. Note if the abdomen is distended by fluid or gas. The presence of fluid can be confirmed by demonstrated shift in dullness. Percuss or tap first with the patient lying supine, flat on their back. Then ask the patient to lie on one side and percuss again. If fluid is present, the dull note heard on percussion moves. Palpate each region feeling for tenderness, pain when touched, or masses, palpable enlargement of tissue. Note also any guarding or rigidity shown by contraction of the abdominal muscles. Guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is a sign of peritonitis. Listen for bowel sounds. B. The feces. There are several words for the feces. Doctors sometimes say there was blood in the stools. Have you passed black stools? Patients sometimes say, my motions have been very loose lately. Bowel movement is used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of how a bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, hard unfrequent stools, or diarrhea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale. Hard, formed, semi-formed, soft or loose, and liquid watery. The color can vary from black due to altered blood as in melina to yellow, gray, or even white. Melina stools are often described as tarry, like tar, the black sticky substance that is used in road making. The stools may be red when fresh blood is present. Blood can be the only blood that can only be detected with special tests is called Fecal occult blood, FOB. When there is a high fat content, the stools are pale and sometimes described as clay colored. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. 21. Gynecology. The female reproductive system. Womb, fallopian tube, ovary, neck of the womb or cervix, and vagina. Menstruation. A period is a common name for a menstrual monthly period. The onset of menstruation is known as menarche. The, lar- the last menstrual period is commonly abbreviated in doctor's notes. LMP 252 ago means the last menstrual period was 2 weeks ago. The menstrual cycle, or length and frequency of periods, is usually written in the form 428, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss. Menorrhagia, often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In every English, in everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of heat, and night sweats. A gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist, are your periods regular? Patient, yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last usually? 5 or 5 days. Would you say they are light or heavy? Light. Do you get clots? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color is it? White. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, also known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women. 22. The heart and circulation. 1. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe cases, it may be present even at rest. A patient who is breathless when lying flat, orthonia, for example in bed, will tend to sleep raised up on two or more pillows. The abbreviation SOBOE stands for shortness of breath and on exercise or on exertion or an effort. Patients say, I get terribly short of breath climbing stairs. Doctors ask, how many pillows do you sleep on? Heart rhythm. The normal resting heart rate is 65-75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 per minute. The heart rhythm may be regular or irregular. In an irregular rhythm, arrhythmia, there may be early beats which interrupt the regular rhythm, premature beats, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregularity, they describe the symptom as palpitations. Case 4. A 22-year-old student was admitted to hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath on exertion, orthopnea, and palpitations. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms. of heart failure but was followed by episodes of atrial fibrillation, which had been particularly severe for the 6 months before admission. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute, for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema, swelling, beginning in the feet and ankles. This is known as pin edema. If, when a finger is pushed into the swelling, it causes a small depression or pit. We have here an example of the heart. We have the aorta, pulmonary artery, pulmonary veins, tricuspid valve, mitral valve, and the septum. Chapter 23. The heart and circulation 2. A. Physical examination. Medical examination is normally carried out in four stages: inspection, looking, palpation, feeling with the hands, percussion, tapping with the finger, and auscultation, listening with the stethoscope. Note: the verb is palpate, the noun is palpation, not palpitation. Examining the heart and circulation. Here is an extract from a textbook description of how to examine the cardiovascular system. Look at the lips, tongue, and nails for the blue discoloration of cyanosis. Cyanosis may be central or peripheral. Inspect the hands for clubbing. Feel the radial pulse at the wrist and note the rate, for example, 7 per minute. And rhythm, regular or irregular. The pulse may be irregular in force as well as time. Check that the other peripheral pulses are present. Measure the blood pressure and assess the jugular venous pressure, JVP. Palpate the chest for the apex beat. The normal position is the fifth left intercostal space, 1 centimeter medial to the mid-clavicular line. Feel for any thrills. Heart size may be measured by percussion. Listen for murmurs and other abnormal sounds. For example, friction rubs beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and rough. Note the time of any murmur in relation to the cardiac cycle. The most common murmurs are mid-systolic in the middle of systole, pan-systolic lasting for the whole of systole, early diastolic, mid-diastolic, late diastolic, pre-systolic. Continue by listening at the tricuspid, aortic, and pulmonary areas. Areas of auscultation, the letters indicate the approximate position of the heart valves. P is the pulmonary valve, A is aortic valve, M is mitral valve, and T is tricuspid valve. The circles indicate the position for auscultation for cardiac murmurs indicating valvular heart disease. The ribs are numbered.